Thank you very much, Stephanie, and thank you everyone for joining me this morning. I realize for some of you it is quite early, so thank you for giving me your time today. We're going to be talking about some universal assessment challenges in healthcare-related education. I recently presented this or a similar presentation at an international conference, and the great discussions came out of that. And it reinforced the notion that we are all in this, regardless of the healthcare field that you are in, we are all facing the same assessment challenges. So for the agenda today, we're going to spend a few minutes establishing the context for this presentation, some of the internal and external drivers that are leading the assessment conversation. We'll discuss how we capture data through a coding mechanism. We will speak briefly about exam blueprinting and how we use that to plan for documenting our curriculum coverage, and then discuss how we can effectively capture the learning analytics. So let's start with some of the external drivers for our context. What we have seen, I'm sure everyone is aware, that accreditation standards increasingly call for documented assessment data and greater accountability for the assessment practices. Myself, I'm dealing with two changes for accrediting agencies we are dealing with. Both are changing their standards as of 2016, and both are emphasizing this need to document assessment data. For an example, the Basic World Federation of Medical Education Standards, Dr. Hayes really wrote a great article on this in Medical Teacher. And what he discussed was the need for strengthening requirements for alignment between teaching and learning, for formative assessments with provisions for feedback, and assurances that graduate outcomes are assessed. These are specified in the new Basic World Federation Medical Education Standards. Similarly, the standards for accreditation for medical education programs leading to the MD degree call for 8.2 says uses formally adopted medical education program objectives. So the objectives really have to be clearly stated and use a variety of outcome data. Employ these measures for assessment of student achievement, including students' acquisition of knowledge. Also 9.7 states ensures that each medical student is assessed and provided with formative feedback to allow for sufficient time for remediation. That's a significant driver for us here. That leads to our internal drivers. From the student perspective, what is forcing us, or I don't want to say forcing us, but encouraging us, it's the right thing to do anyway. We want to identify student weaknesses and remediate early. We wanted to do that anyway. If we do that, it will satisfy those accreditation standards as well. Internally, from the faculty perspective, also we wanted to collect formative data for continuous improvement of teaching strategies and curriculum. If you mention this in a formal context to faculty, some of them bristle right away when you bring up formalized assessment. But if you say, well, do you try things in the classroom? Do you try new things all the time? Yes. Do you check to see if they work? Yes. Well, then you're doing assessment. And we're continuously informing our pedagogical practices by observing what happens in the classroom and what is the return on our investment of time in terms of the student learning. From the administrative perspective, we are very interested in documenting the curriculum coverage. We know what we want to cover, but we want to check to make sure that we are covering it effectively, and we want to document exactly where and how we are teaching the curriculum, and most importantly, how well the students are learning it. So with that in mind, our old curriculum map, and this would satisfy the old standards and the old accreditation visits. I'm sure this looks familiar to many of you. You have a number of courses in the program, and then you have a number of learning outcomes or accreditation standards. You put a little X in the box where the learning outcome meets the course, and as long as there are no columns without any X's, voila, you've covered the curriculum. And that used to be sufficient. It is no longer sufficient. What we're doing now is we're taking that same map and putting in that map how the students are doing on each of those. So if we're looking at this map, Learning Outcome 3, the 185 you see in parentheses, that means we have asked 185 questions or given 185 assignments to assess that particular learning outcome. And at that point in time for this class, they achieved a 65.9. That was obviously not something we're satisfied with. What we want to see is at least an 85. So we get a couple of areas here that needed some work. This was done fairly early in, I think this was a P2 class, a second-year class, and obviously we addressed that learning outcome. I'm pleased to say it's up to an 80% now, but we're still working to raise on the student achievement on that learning outcome. The difference here is, again, saying we know we're teaching these things, but now we have to document that the students are learning them and at what rate or what is their achievement level. We all know that knowledge gaps can certainly lead to medical errors, and we certainly want to address the knowledge gap, all the knowledge gaps we can identify. So how did we do that? How did we disaggregate the test data so that we could narrow it down to what learning outcomes the students were addressing? What we do, and we employ ExamSoft to do this for us, having a technological tool to do this is really important. We tag, or we use the term code. We code each single test item or a dimension on a performance rubric, and I will demonstrate this. We code it, and we code it at the accreditation standard level, at the learning outcome level, and we also use Bloom's taxonomy. I've also seen a lot of people use Miller's pyramid of assessment. Some people use Krathwohl. It doesn't matter. Some people simply state we tag it to the introductory level, the proficiency level, and then we have exemplars, or there are as many ways to tag the levels of difficulty as there are schools I've been to, but two of the most common are going back to Bloom's taxonomy and Miller's pyramid, and I will demonstrate that. So you're thinking about, if you had the opportunity to take every question you ask the student and say, gee, what could I document with this particular item? I'm going to encourage you to think, what would you code? What information would you want to capture from every single test that you give? Now let me give you an example. So in the National Board of Medical Examiners, the USMLE Step 1 exam, these are some of the topics that are covered if you pull up the blueprint, right? Behavioral sciences, biochemistry, biostatistics. So if I were coding this, I might create a code that says S1, this would be my code for Step 1, Topic 1, Step 1, Topic 2, Step 1, Topic 3, Step 1, Topic 4. So everyone knows, okay, this is for topics for the Step 1 exam. Easy enough, people can remember that. So every time I asked a question that had to do with biochemistry, I would tag that question with S1.02. And if it had biochemistry and it was a rich, thick question, and it also addressed, let's say, gross anatomy and immunology or the immune system, I might tag it with all of those, SO1, O2, and 08, and 10. So you could code a single question, particularly if it was a case, and if it covered multiple systems or multiple topics, you could code it multiple times. So here's an example question that was posted online, usmle.org. So if you think about this, a 32-year-old woman with type 1 diabetes, if you read this whole question and you think about what does this cover, certainly for us, we would code this for diabetes. And if I want you to think about what else you would code this for in terms of whatever scheme you came up with, information you wanted to capture. For us, this would be a synthesis level question as well. So this is not strictly a knowledge-based question. It is certainly applying the knowledge, but I think it goes a step further because it asks for the synthesis and asks you to make an evaluation of which of the following is the most likely cause. Because you're getting into that evaluative area, we would probably code this at the synthesis level. So as you're looking at this question, you're thinking, what would you code this for in terms of coverage of USMLE topics, and maybe perhaps in terms of the level of Bloom's taxonomy? Now, here's an example. This is a screenshot from ExamSoft. If you were writing a question, right now this would be the stem of your question here, and you would put your multiple choice answers here. Obviously, you can do more than simply multiple choice questions in ExamSoft, but I'm using this. You could put an entire case in here, for example. Some of our faculty take JPEG images and put them in there. They might put an image of a histogram or an image of an EKG or something else, and then ask questions about that. The point I want to make here is there is a section on the left-hand side where you can add categories to that question. So you can say, okay, this is a synthesis level question that addresses the cardiovascular system plus the respiratory system, and it deals with diabetes, and I can code it at all those levels. How I would do that is you open up your category folder, and this is actually our category folder. If I expanded this, Appendix B, which is our accreditation standards, the topics we must cover, if I open that up, you would see 35 different topics in Appendix B that I could code it to. We code the knowledge application or synthesis level of Bloom's taxonomy. We use 3 out of the 6, and I'll talk about that a little bit more. So in this case, I highlighted renal. If I wanted to code something to renal, I would simply click on the plus sign there, and it would bring it up to the right-hand side of the screen and show me what it's coded to. Now, as many times as I clicked here, it would add on the right-hand side, so you can see exactly what you've coded that question to. Another example from the pharmacy school, we code Appendix B and Appendix D. We code knowledge application and synthesis. One is accreditation standards, one is Bloom's taxonomy. But here's another thing I wanted to share with you that I thought was kind of clever. Our faculty requested this. I was very reluctant to give the faculty too many different ways to code at once, because I really didn't want them to think this was going to be a great deal of work for them or problematic. So I didn't add this cumulative questions code, but they asked for it. So let's say you were teaching in the first year and you had a fundamental concept that you tested the students on, and you know that this is something you must remember. It's critical knowledge. I'm going to put that in that cumulative bucket for the fall of the first year. That means it's fair game for anybody who comes after me in the sequence to go into that cumulative question bucket for fall of the first year and pull that out and reuse that question again. This is our faculty really like doing this. Let's say, example, in the pharmacy school, the first year, we teach top 200 drugs, and they need to remember this. So let's say you're teaching in the third year, and you want to test the students on the top 200 drugs related to the disease state that you are covering. You go into that cumulative bucket, you look for something, top 200 drugs for diabetes, and then you ask one of those questions from the cumulative file. So you don't have to invent every question. You're borrowing from the test bank for good questions that your colleagues in the faculty have written. And again, that was completely a faculty idea, and I thought it was pretty wonderful. So again, I'm just expanding this so you can get a better look at Appendix B. The first one, BO1, is anatomy and physiology, and then pathology and the microbiology, etc. And if I expanded that first one, anatomy and physiology, it's further broken down into structure and function, molecular aspects, cell physiology. You can, my point in this is you can break it down as fine as you want. When I captured this screenshot, it was fairly early in our adding test questions to the bank, but at this point in time, for example, that 310 that you see on the screen shows that we had 310 questions in the test bank that related to Appendix B, anatomy and physiology, specifically structure and function. So if you're looking for a question that deals with structure and function, just dig in. You have 310 to choose from right there. So coding at the course level is another option. Not all of our faculty choose to do this, but it's worth mentioning. We all know that a student learning outcome is generally written. Students will be able to do something as observed by. So you'd say they're able to do this as demonstrated by. Well, we have abbreviated that very, very short, and this is the top 200 drugs class, and we know the students have to do classification, drug indications, counseling adverse effects, brand generic, etc. What this faculty member did is take the 9 learning outcomes from his course, and he coded each of his questions to his own learning outcomes. Now, what that enabled him to do is share with the students, hey, these are the outcomes for this course. I'm going to see how you're doing on every one of them, and you're going to get a report from me on how you're doing on every one of them. So invite them to remediate where they are, where they're struggling. What I will take a moment to tell you what this particular faculty member did is he tracked it over a 3-year period. And the first year he was finding that he wasn't covering certain areas as robustly as he thought he was. For example, he was asking very few questions in a certain area and favoring others. So he balanced his questions out more appropriately. He tried some different pedagogical strategies to address areas where students may be performing a little lower. And then he made the evidence-based changes to his pedagogical strategies. And then he wrote a wonderful paper about it and how he made changes to his class based on evidence. So it was a win-win-win. The students won because they got really detailed information about what they were learning in that classroom. I was certainly happy as a curriculum administrator to be able to document such rich coverage of the curriculum. And he got a paper out of it and was able to also use this for his dossier to demonstrate his effectiveness of teaching. So we talked a little bit about Miller's pyramid of assessment. And the pyramid basically is that knowledge level, knows how, shows how, and does. So if you were coding, if you chose Miller's pyramid to capture at what level you were teaching this, you might put, this is what I believe in simple. So MP, Miller's pyramid. I try to make it so that it's very instinctive for the faculty. So Miller's pyramid level 1, they know. Pyramid level 2, they know how, shows how, and does. So that's the coding scheme I would use. Keep it very, very simple. I mentioned we here at the pharmacy school at St. John Fisher College, we code to Bloom's taxonomy. And again, with that idea of keeping it simple, we call it BT1, BT2, and BT3. So everyone knows that's Bloom's taxonomy. Why did we code to only 3 levels instead of 6? Well, I've done professional development training at many, many schools. And as Stephanie mentioned, across many different healthcare fields. I have yet to see a faculty that can code accurately at 6 levels of Bloom. It is too difficult. The distinction between a question that is asked at the knowledge and comprehension, the knowledge level versus the comprehension level, if you can't have all of your faculty code it the same way accurately, then it doesn't give you good data. What we could do, however, is say knowledge and comprehension, that's the fundamental level. Applying it and analyzing it, that's the secondary level. And synthesis and evaluation, that's the third level. We could code fairly accurately to that. So that's why we chose to use those 3 levels. It works for us. And again, that is what we're interested in tracking. So it does sound like an incredible amount of work. And actually, it's less work than you realize, though, because you code a question once and it's coded forever. But why bother? If you think about it, the faculty are generating these assessments anyway. And our faculty, and I'm sure your faculty, they work very long and hard to create good test items. What happens is all the data from the individual test items really does get trashed. And what I mean by that is you've constructed this great exam. It's covering 6 different topics. And then the students come out and say, I got a B+. They're not thinking about, I did well in respiratory, but I tanked renal. They're just saying, I got a B+. And we don't want that data, the individual data, to be thrown away. We want the faculty to be able to look at it, and we want the students to be able to look at it. I hate to see a really well-written exam get reduced to a single grade. So you think about this. Now, here's an example from Assessing Health Profession Education, and the National Academies Press has this great piece out on assessing health profession education. And here's an example of IPE. We all have trouble assessing, or at least here we do, interprofessional professionalism behavior. So here's, for example, categories: communication, respect, altruism, excellence, ethics, and accountability. And it has examples of this. Well, imagine if somebody was graded on this and they just gave it 1 grade, you wouldn't know if the student was having trouble with the communication piece or they were having trouble with the ethics piece. If you disaggregated and coded each one of those components separately, then you could say to the student, well, you have everything else down cold, but your communication skills are a little lacking, and that's where we're going to target your work. So if I were translating that into a rubric in ExamSoft, now I tried to blow this up so you can see this. We would create, here's an example of a 3-tier rubric from our professionalism. It's 1 line from our professionalism rubric. And we break it down to exemplary, meets standards, or needs attention. Obviously, we want all of our students at least at meet standards. On the left-hand side, you see this opportunity to put categories. You would put categories there. You would assign them the same way you would assign them to a multiple choice question. So in this one, we're saying this is application, this has to do with professionalism, and this has to do with effective verbal communication. So we would put the dimensions of the rubric, what constitutes exemplary, what constitutes meet standards and needs attention. We would give it a weight. Now, on our professionalism rubric, we have, I think, 10 different dimensions. Each one is coded differently, and each one may be weighted differently. I'm going to pause a moment to give you an example of how this was very effectively used by one of our faculty. So she had a project where she asked the students to do, she held a mock conference and had students do poster presentations the same way it would be done at a real conference. So let's say you were graded at 3 levels on this. One was the graphic presentation of your poster. The second way you were graded was the oral presentation as you stood in front of your poster. And then the third one is the content and the research that went into the materials on this. Now, if a student just says, I got a B, they don't know what they excelled at and what they perhaps did poorly in. Maybe that student who received a B on the project had an A+ for the content and an A+ for the visual demonstration and a C- for the oral delivery. So if you say to the student, well, you know, your research was amazing and the graphic presentations really catch the eye of the audience, but you have to learn to speak up and speak with more confidence because all that work is being lost with your very quiet and your demeanor in presenting. So the student gets to disaggregate that, and you get to give much more detailed feedback to the student. So the important thing there is disaggregating that big lump of data. And now I realize this is too small to see the words, and don't look at the words. What I want to show you is that overall this is what a big rubric would look like. This rubric has 4 different levels. On the left-hand side, these would be the dimensions. This would be where your categories are, and this is where you would rate them. That's just what it would look like. You would take that rubric and you would pre-release it to the students so they would know what they would be evaluated on. Then you would send them instructions on what to do. And then and the student submission side is some of the rubrics your grading is on a written paper. So if you ask the students to submit a paper and it would be graded on the rubric, they get the rubric, they get the instructions, and then when they're done, they upload their paper. And what happens in a paper situation is you'd see the content on the left, and you'd see the rubric on the right, and you would go in and grade them on the rubric. Also, you have the availability of writing your comments right there to the students. And this isn't, you can write comments on the whole project, but you can also write comments on every single area. And again, I'll use that example. If they did really well on the research, but very poorly on the oral presentation, you might make a suggestion on how they could improve their oral presentation. So again, this is an example from a diagnosis medical clinic midterm. The student gets, and I know you can't read it, I'm just asking you to get a visual representation. These are the different levels the students can achieve. These are the standards, and they get comments underneath for each dimension of that standard. So we do get to use this. Also, I wanted to mention multiple graders, and we've started using this now. So if you have, and we do clinical consults with standardized patients, and they're observed and graded. The students are observed and graded. Now, I can say, well, as the faculty member, my grade is worth 80%, or the standardized patients is worth 80%, and my input is going to be worth 10. And by the way, you're going to self-evaluate, and that's worth 10%. So we can break it up, have multiple graders, and give the different graders different weights. So the standardized patient gets the most weight, the faculty member gets another, and you can distribute that any way you see fit. So we've started using that multiple grader aspect. So how does this translate into the faculty use of the data? Here's a quick example. So in the past, the faculty said, okay, I have these outcomes, and I assess them by exams and papers and presentations, and I can chart that for you pretty well. But now they're saying the same thing. Here are my outcomes, here are my assessments, but here's how the students are doing. And here's the number of items that I have. Now, if you look at this chart, obviously we have a couple of areas where the students are underperforming, so that's my goal now. I want to see what I can do to beef up that the student performance there. And in terms of the number of items per outcome, it may be appropriate. Maybe those were very big items, so there are going to be fewer of them. Or maybe course outcome 5 is not as important as course outcome 4. So if this imbalance is appropriate and deliberate, fine. If it was accidental, then you have your chance to correct it. And as I said, in one of the cases of the faculty, he realized that he was actually not giving the attention to a particular outcome that he thought he was, because he had never counted the number of items before. And when he counted them, or when the report came back from ExamSoft, he said, wow, I got to give that more attention, and he adjusted accordingly. So that's how faculty use some of the data. Some of our faculty also really engage in using an exam blueprint, and so they're planning ahead of time. Here's a quick example. So in this particular exam, the learning outcomes had to do with the immune system and microbiology and immunology. So one professor taught for 6 hours on this, and another professor taught for 4 hours on microbiology. The course coordinator came up with this herself and said, well, here's what I'm going to do. You're going to get 4 questions on this test per number of per number of didactic hours that you have, hence the 24, so 4 times 6. And this person taught for 4 hours, he gets 4 questions, so we get 16 test items. Now, the course coordinator said, I really want the bulk of the exam to be at the synthesis level because these are third-year students, let's say. So let me try to create a balance so that 45% of the exam is at the synthesis, 30% at application, and 25% at knowledge. Now, obviously, this is a guideline. They may say, hey, you know, I want 20-20-60, or I want, you know, whatever percentage you come up with. The point is that you're aware of the level. You're not putting 40 synthesis level questions in exam and giving them 50 minutes to do it. That doesn't make sense, right? If you want critical thinking, you have to give time to critically think. So you want to sprinkle certain knowledge questions that the students are going to take 30 seconds to answer, and then you want the more robust cases where they will take more time. We want that balance. So creating an exam blueprint allows for the faculty to really plan exactly what's going into exam and balance the time. I'll use this, take this moment to say a kind of neat feature. Once you've given a test item in ExamSoft, you get an historical record of it. So if you wanted to, you could look and say, on average, students took 30 seconds to answer question 1, 15 seconds to answer question 2, but 5 minutes to answer question 3. So you have an idea of how long the average student spent on every single exam. So if you wanted to and you were concerned about time, for future exams, you could look at the timestamp for each of the questions and say, hey, you know, they ran out of time because I gave them 50 minutes and I gave them 40 questions that took much more time because they were at the synthesis level. That's why they ran out of time. So the amount of data mining that you can do is actually pretty impressive. What's also pretty neat is the faculty can get at the end of every exam great detailed data coming back to them and how the students did in each learning outcome. For example, here on anatomy and physiology, the red indicates the low grade for the class, the blue is the class average, and the green is the high grade for the class. So you're going to get this information for every exam that you give. You can also look at the question performance. So for each test item, you will see the percentage correct, the upper 27% of the class, the lower 27% of the class, the point by serial, the discrimination index, and the response frequency. As an assessment person, I'm always stressing to faculty, you know, point by serial is a wonderful thing, but really don't say, well, it had a low point by serial, I'm going to get rid of it. Some faculty actually came to me and said that, oh, it's got a 0.02 point by serial, I got to get rid of that question, it's no good. I said, no. Remember, we're criterion referenced here. There are certain things that students absolutely have to know. You want 100% on that question. If they don't get it, they're going to kill somebody. So you can't look at it that way in terms of point by serial. Look at the question. If that question is a critical question that students must know, and they scored it a 96%, I wouldn't say, no, the score is too high. I'd worry about the 4% who got it wrong. So you really have to think, I really encourage faculty, yes, look at the point by serial. It tells you what questions to look at first, but certainly, let's say this question that scored a 0.02 point by serial was a cumulative question that we discussed earlier, a fundamental element that you stuck in there. Well, obviously, you want that to be very high performance. What I'm concerned more in this chart is the distribution of the response frequencies. If I look at this question, the point by serial was great, but what does this tell me? 41 is the right answer. This B is the right answer. But I've got 33 students who got it wrong. So that tells me as an educator, I have confusion in the classroom. Let me go look at that question and see what the students are confused about. Because I really don't want 33 students to get this wrong. So I'm able to look at the questions at a really nice level. Quickly, the students' use of the data, I will say, go back to this. This is a real case. We had a student who just, he was an A student. Everybody thought, there's no weaknesses here, right? He's great. Again, all you look at is that big lump grade instead of the outcomes. But when we disaggregated the data, we saw that in learning outcome 3 at a 72.5. Now that learning outcome happened to be calculations. You don't want a pharmacist who is poor in calculations. You have to remediate that. But again, he had so few questions per exam on calculations that he'd still get an A in the exam, but so his weakness was hidden. Here, that's a really good example of the use of disaggregating the data. So the students get that report, and they get it in terms of a histogram, much like they get bar graphs. They also get a histogram, but in this case, they see the cognitive domain, the processes, and if they're below the class average, they get a red arrow. If they're close to it, they get a yellow, and if they're above the class average, they get a green. So they get a quick performance snapshot. Here is an example of what a student might see. My score, the average score, so I get a green arrow because I was above the class average. In this case, I was below the class average. And so it may have been a passing grade, but there's still a warning that that's a weakness area. So students can get this for every single exam that you give them. This is an example of what you could give them at the question level. Our faculty do not do this. Our faculty do not give the questions back because they want to use these questions again and again for future classes. However, you could give this detail back to the students. So it would show you this is the correct answer, and this student got it correct. This was, bacteria was the correct answer in answer 2, but the student chose this. So you can give this to the student, and by the way, it tells them their learning outcomes. We don't. What we do instead is give them this kind of report. And again, I know you can't read it, but I wanted to give you a full visual where all the learning outcomes are on the left, and they get, this is the class average on the right and themselves on the left. So this student knows he's in the red here, yellow here, and the red here. So that's the level of detail we give to our students, because we don't want to give them the question back, but we want them to know the area where they did well and the area where they did poorly. So how we might use this, this is strange how this is looking here. I don't know why, but I have no idea why this appears this way. But here's how, a report I might give to my faculty in terms of their advisees. This line right here is one advisee. This line is another advisee, and the third one is a different one. So I could look at all my advisees and say which ones are struggling in which area. I've got advisee number 1 who's struggling with respiratory and gastrointestinal. And then when that student comes to see me, I can speak with him or her about the struggles. When I look, now I'm going to look at very quickly from a curriculum perspective. I can look at all of the data and create a longitudinal report. It's nice. We've been using ExamSoft for 3 years now. I can look at year-over-year data and say the number of exams and projects in cardiovascular for a period of time was 35. We had 293 assignments, and the student average was 82. The level of detail I can get on this right now from a curriculum, if I look at the entire curriculum, is pretty impressive. So I just ran a report. I didn't put that clip in here, but this the number of items is close to the thousands now, and I can tell you with much greater accuracy what the students, how the students are faring on our curriculum. So using these analytics effectively, we create exam blueprints. We plan for the coverage of the outcomes. So it isn't haphazard and it isn't just random. We very carefully create how we're going to plan the coverage. And then we review the exam level results reflecting on the teaching and learning. As I spoke about earlier, we'll look at each and every exam, what the students are doing well. And the assessment is as much about teaching as it is about learning. If your class average in an area is 65, it's a partnership there. We've got to do something in the teaching because the learning wasn't there. We save exam summaries and we create an archive. And the faculty are really using this effectively. I worked with 4 faculty this past summer who were submitting their dossiers in the fall. And they wanted to demonstrate that they were effective teachers. In the past, all they had to go by was student evaluations. I said, well, that's a fine point. You get great evaluations, but that's not enough. First of all, that's indirect data. We want to triangulate your data. So let's look how the students did on your learning outcomes. They did really well. So we took what the quantitative data showed you in terms of your student outcomes, plus the qualitative data of what the students had to say about in their perception of covering it. And now I've got a better picture to present in the dossier with respect to teaching. And faculty are using that. Is it always stellar on the quantitative side? No. We had a first-year teacher who had some learning outcomes that were really low. And I said, well, that's great. You have the opportunity to try a different pedagogical strategy and see if you can change those numbers next year. So you have an opportunity to demonstrate and tell a great story. We share all our summaries with the students so that we engage them in the assessment process. So if you tell them, here's how we're doing in this area, or here's how you're doing in another area, they get engaged in the assessment process. I generate longitudinal reports to track progress over time. And that information is shared with both the curriculum committee and the assessment committee so the faculty can take a look at it and say, gee, renal is our lowest point. What are we going to do to help the students better understand particularly acute renal disease? We also ask the students to reflect on their longitudinal reports so they can plan for future study. Now imagine you're a third-year student, you're just ending before you go into experiential or before you take a major exam. You've studied 100 topics. You look at your longitudinal report and you see that you have 4 areas of weakness. Well, that's where you're going to spend most of your time studying because you can't study all 100 topics. So the students can really use this to reflect on their personal strengths and weaknesses and plan to study accordingly. And then, as I mentioned earlier, we use the data as evidence of effective teaching. We also use the data for the Scholarship of Teaching and Learning. At the AACP conference, which is the American Association of Colleges of Pharmacy conference, annual conference, last year, our faculty produced 23 posters, presentations, and roundtables, much of which was on the Scholarship of Teaching and Learning. And of course, we use the data on a big scale to look at program effectiveness. Are we covering everything we say we are, and are we addressing the weaknesses that we find? So again, the data provided for the students informs the study and guides remediation. The data provided for the faculty documents the coverage of their course outcomes, identifies the area of the student and the cohort weakness. It provides opportunities for the Scholarship of Teaching and Learning and evidence for teaching effectiveness. For me as an administrator, it maps the curriculum, it documents the student performance, and it documents evidence-based changes that are made. So if I go back to where I started, if you think of those things in terms of what is required by the Basic World Federation, they're looking for an alignment between teaching and learning. Check. We've done that really well. They're looking for formative assessments. Check. We are using all of our data formatively. They're looking for assurances that graduate outcomes are assessed. Yes, we are assessing each of those outcomes. From the medical education programs leading to the MD degree, they want clearly, formally adopted program objectives. We put those in and we code to them. They want us to use a variety of outcome data. We do performance assessments, we do didactic exam assessments. They're looking for measures of assessment of student achievement. We've certainly focused on that. And they are asking, again, that each medical student, each individual student is assessed and provided with formal formative feedback. That's different than just saying the class average is, but each individual student get his or her own longitudinal report. And we are certainly do that. So we are addressing those things that are being pulled up with the external drivers. So I tried to cover all of this to allow some time for questions, and I open it up now. And I hope you do have some questions for me. Thank you.
Wonderful. Thank you so much, Dr. Souza. That was a wonderful presentation. As Jane mentioned, we're going to go ahead and open up the floor for questions now. If you do have any questions about the presentation, now would be the time to type those questions into the questions area of the GoToWebinar control panel, which should be on the right-hand side of your screen. I'll go ahead and read them out, and we'll give Dr. Souza the opportunity to ask. It looks like we do already have a couple of them ready to go, so we're going to go ahead and get started. Dr. Souza, the first question is several parts, actually. What was the process for developing your coding structure? Was there a committee involved, and how long did buy-in from the entire program take?
Okay, good questions. I'm just writing this all three parts down so I don't forget. First of all, the process for developing the coding, we started right away. It was a no-brainer that we were going to code to our accreditation standards. So as I told you, we have an Appendix B, so we called it B1, B2, B3, B4. We decided that in the assessment committee pretty quickly. But the other levels of coding, we decided to do systems, and then we went to the faculty and said, what did you want to see? What longitudinal systems did you want to track? And the faculty said, well, we want the systems out of DePiro. You know, we want respiratory, we want renal, we want neurological, we want gastrointestinal, blah, blah, blah. So they came up with 19 systems that they wanted to track. So then we call the S, O1, O2. So S is systems, BT is Bloom's taxonomy, B is Appendix B. So we made it very clear. You're not going to mess up Appendix B with a system because one is B and one is S. So the curriculum committee and the assessment committee were involved in this coding process. Again, we tried to keep it very simple and intuitive and ask the faculty, what do you care about coding? Again, we did not ask them to code at the classroom level. Only the faculty who came and said, I want to code at the classroom level, are the ones that are coding at that level. The rest are just coding at, here are my accreditation standards, here are my, my level of Bloom's taxonomy, and here are the program objectives, the systems. So that's how we developed it, very much involved with the faculty. In terms of a timeline, what we did is I think it's important to find your champions first. The first semester we did this, we asked faculty who wanted to be our pilots. And we had faculty from 2 different departments who really wanted to do this. We gave them each an iPad as an incentive, and they went into their courses and they did the first ExamSoft test and the first things of coding. They produced the result and then showed it to the rest of the faculty. We voted as a faculty to go all in. So we went from a pilot of 2 courses in one semester to the fall, that was in the spring semester, to the fall of doing all of our work in, because we decided if we wanted to track the whole curriculum, the only way to do it is to get everybody in. Having said that, I have been to many institutions across the country and work with the faculty on gearing up this process, and some of them do it much more slowly. They do it by department or do by course. You know, we're going to do this sequence or that sequence. However they choose to do it, I think it's important that you bring the faculty along, identify your champions, and then give the opportunity for your champions to be the ones to present what they're doing. So if they're doing some wonderful work and they're publishing it, great, have them show the rest of the faculty. If they're excited about the changes they've made or the data they're getting, great, have them show the faculty. We did it pretty quickly here, I have to say. 1 semester pilot and then the next semester all in. I hope that answers your question.
Wonderful. Thanks so much, Jane. The next question is, do your faculty input and code their own questions, or do you have an IT staff handle that?
Oh, absolutely, they code their own. And I do want to say a word on that. Our dean, in terms of putting the questions into the data bank, typing them in, you can import them into ExamSoft. And our dean went one step further. He offered administrative support to anybody who had old exams that they wanted to have typed in, actually, into the test bank. None of our faculty took him up on that piece. Because they own their questions, they don't want anybody messing with them. They wanted to be the ones who put them in. But it's, in terms of the coding, if you think about it, only the faculty know what they're coding to. If you have a really good, thick case study, they know what's required to answer that question. And they have to code it. They also have to do the levels of Bloom's taxonomy. They frequently come to me and say, hey, Jane, what do you think? Because I have a PhD, but an MED also. So I do have some area and expertise in this. But the faculty own their coding. They're very possessive about it. They take ownership of it, how they want to code it. And you know, it isn't as onerous as you think. So imagine we have a list with all the Appendix B topics or all the accreditation standards and all the systems. What I say to the faculty, that looks like a long list, right? Read it and highlight the ones that you teach. Great. So now when you go to code your questions, you don't have to look at the others. Just look at the ones that you teach. I mean, and pretty much that's it. Sometimes you're going to reach into a case that involves, the student has, the patient has COPD and diabetes and something else, but you're teaching the diabetes. If they need knowledge of COPD to answer your question, then yeah, you're going to also code it to that. But the faculty really know what they're doing. The coding is a matter of clicking a box. It is not onerous, and they wouldn't trust anybody else to do it but themselves.
Great, thank you. Next question is, how difficult was the upfront work?
The upfront work, I will be honest with you, the most pushback we got in going into this did not come from where I thought it was going to come from. I thought it was going to come from the faculty. It didn't. It came from the students. When we moved into an electronic environment, all our students take their exams on a computer. Now, it's hilarious because they come in with laptops, iPads, and Droids and iPhones. And then I said, we're going to take our exams on a computer. And they said, what? No paper? Honestly, that was the biggest pushback we got. What? No paper. So we thought about that, and here's how we solved that. Students like to have a piece of paper in front of them, some of them just to doodle because it's a stress reliever. Some of them do a brain dump. They walk in the classroom, they write down everything they think they have to know, and then they use it to answer the questions. We said, fine. Here's what our faculty do. It's kind of creative. They come into the class. We have 85 in a class. So they come into a class and exam, and they have a different piece of colored scrap paper every time. So today it's green. They pass it out. They say to the students, you write your name on that, and that's attesting to you are the one who's sitting at that computer taking it. So I've got your signature. And then you use that paper to do your calculations if you want, to doodle if you want, to do whatever you want to do. I'm collecting it at the end because it's my attendance, it's my verification that you were in the room, and it's your piece of paper that you really want. So we have it serve all purposes. If for some reason the faculty want to provide a handout in addition to whatever they've uploaded in ExamSoft, they give them the handout and they use the back side of the handout for the scrap paper, for the signature and all of that. So we still give the students the paper. But in terms of the rest of it, the software is really, really intuitive. I work with faculty all the time, and I launch their first exams with them. And some of them I launch their second exams with them, just to gear them up in terms of their confidence. But in terms of writing a question, you put the STEM, you put the options, and you save it. I mean, it's pretty fundamental. It's pretty basic. The gearing up was not difficult at all. The faculty love that they can look at their exams, create their exams, modify their exams, modify test questions, all from their house, from their clinic, from their office, from waiting to have their oil changed. I mean, our faculty are doing this from anywhere because all their work is web-based, so they can access it anywhere. I monitor exams on my iPad all the time. So if I know I've got exams going on gee, did everybody upload those? I'll just pull up the exam, look, I've got 89 out of 90 uploads. I ask which one hasn't, and I can see which student is delinquent and just send them a quick note. The faculty liked it a lot more. I was expecting a lot more pushback. Students took a little while, and now they don't want to take any more paper exams. And I personally never want to see another fill in the bubble again. That was really much more frustrating.
Great, thank you. Next question is, can questions be imported from Blackboard or other systems? And if you need me to take this one, I can, Jane.
Yeah, they can be, and yes, Stephanie knows much more about the technical aspects of that, so I'll let you go.
The answer to the question is yes. We have a really great integration with Blackboard specifically. Other LMSs, it really just depends on the specific one. We know that a lot of different programs work with either some of the big LMSs like Moodle, Canvas, that sort of thing, and then also a lot of programs have homegrown systems. So the answer is yes. Specifically with Blackboard, we have a really great integration that will push all kinds of information back and forth, and with others, it really just depends on the specific type.
And I want to add to that, we had a professor who had been teaching management course for a number of years. He had 400 questions. He uploaded them all at once, okay? So he had all 400 questions in ExamSoft, but then he had to code them. Well, you know, they were all coded to management, and then he broke it down into the different aspects of management, and he bulk edited them. So what happens, in other words, you can bring all these 100 questions and coded to the same thing. You select all 100, you bulk code them, put them all in management, put them all at the application level, put them all, and they're instantly all coded. Obviously, then he would go back and refine certain ones that might have been coded to particular topics. But you can take 400 questions and code them all at once if they're all in the same thing. So that certainly speeds up the process for faculty. If you're giving a test and it's all pretty much on the same topic, code all the questions at once. One thing, and they're all coded.
Great. Looks like we're going to have time for just one more question. Last question we've got is, do all categories have to be available to the entire program, or can faculty members have their own individual structure? Okay. You can do whatever you want with it, but I ask to think in terms of categories. The more categories you have, the more messy it can be and harder to get data from. What we've allowed here is that we have the categories for our program objectives, for our accreditation, as I mentioned, and Bloom's taxonomy and cumulative. The faculty who want to track their individual course outcomes, we give it to them. But some say, hey, can I track every single objective in my classroom? You know, we're going to slow down our system. We're going to have 2,000 categories, and at what point is it not effective anymore? So you really have to have that discussion in your curriculum, in your assessment committees. At what point is too much, I mean, and not useful? We think as far as going down to the classroom objectives, that's useful. Beyond that, we don't want to end up with 2,000 categories to sort through. It's more data than we're going to use. So I'm a firm believer in only collecting data that you would fully intend to use. And we know we'll use it down to the class level, course level, but not beyond that. So I think, can you do it? Yes. Would I advise it? No. I would not advise ending up with thousands of categories, because your longitudinal report will be unwieldy. It'll be so long that nobody's going to look at it. So I'm just being very practical there. Great. Thank you so much, Dr. Souza. We're going to go ahead and wrap it up there today, folks. Thank you so much for joining us. If you have questions for Dr. Souza, her email address is on the screen in front of you. I'm assuming that that means it's okay for you to shoot out questions directly to her. If you have questions about it, yeah, great. If you have questions about ExamSoft or would like additional information, we can be reached at info@examsoft.com. Just a quick reminder, as soon as we exit out of this webinar, you will get a pop-up with a couple of quick questions and a survey form. We would really appreciate you taking the 2 minutes to fill that out so we can continue to provide relevant content. Again, thank you for spending your time with us today, and we hope to see you again in a couple of weeks for Dr. Jimenez's webinar as well. Thank you.
Thank you. Have a great day.